This is a demonstration of the discharge routine for Meditech version 5.66. There are two ways to access the Discharge desktop. From the physician desktop, you can select this icon for the appropriate patient. From the EMR, select the patient, the episode, and click the Discharge button on the lower right corner. This is the Discharge desktop. Start at the top and move your way towards the bottom. The box at the top is the patient problem list. Maintenance of a patient problem list is a meaningful use requirement. Problems associated with this visit are highlighted in blue. To manage the problem list, click the Edit button. To show diabetes as relevant to this visit, click Current Visit. To add new problems, begin typing a diagnosis in the search engine here. Select a diagnosis, specify current visit, and save. Now these problems are listed and specified as relevant to the current visit. There are several sections below that will help you complete the discharge process. First, select the date of discharge. Today's date will default in. Select the disposition, and then move on to medications, orders, referrals, and DME. All of these items can be completed through this top blue Edit button. Otherwise, they can be done separately from each of the sections below. Click the Edit button, and you will see the home medications followed by the inpatient medications. Again, this is most effectively done by starting at the top and moving your way towards the bottom. You can continue, stop, or renew medications. If you select Renew, you will need to specify either the quantity or the number of days for each prescription. And then move on to the current inpatient medications. If you want to convert an inpatient medication to a prescription, again, you will have to specify either a quantity or a number of days. If you choose PRN, a reason is required. This patient was on IV Levaquin and will need an outpatient prescription for oral Levaquin. Begin typing the name of the medication in this box. Select the appropriate dosage and fill in the required fields. For outpatient orders, select this button. If I select 2D echocardiogram, I can specify the service date. The location is defaulted as patient choice, and a diagnosis is required. If you have a diagnosis that is appropriate already in the problem list, it can be selected. Otherwise, you can add a new problem here. Referrals can be done from this screen also. You would need to select Category, Referral, and find the appropriate specialty. Designate the group and the specific provider if known. If you want to use the same diagnoses for subsequent orders, you can click this button. For medical equipment, click this button. Select the appropriate equipment or type an entry into the search field. And select. When all of the home medications, new medications, and orders have been completed, select OK, and you will see the discharge session summary. All the medications and the actions taken are listed here, orders, equipment, and referrals below. You can now enter your PIN number and save if you want to print prescriptions later, or proceed with save and print prescriptions. To print prescriptions, in the action box, select Print, and choose a printer. Printers available on the patient's location are listed by clicking this button. Back on the Discharge desktop, you can now move on to diet activity and CMS measures. This is an extremely important part of the discharge process. DC Consultant Instructions is a free text field where consultant physicians can enter any instructions the patient will need at the time of discharge. Discharge Comprehensive is a template used by the primary attending discharging a patient. If a mid-level provider such as a physician assistant or nurse practitioner is performing the discharge function, they should use this template in order to provide for all the information to be sent to the attending physician's e-sign queue. For this example, I will use the Discharge Comprehensive template. Here you specify the patient's discharge diet, activity, and other restrictions as appropriate. Functional status assessment is a meaningful use requirement. Required fields are indicated by the red asterisk. These two entries will most likely be pre-filled based on nursing assessments done earlier in the hospitalization. If they are not, the discharging physician must specify the patient's functional status with respect to activities of daily living and cognitive function. If home health services have been arranged, it can be designated here. However, this does not create an order. This is only for informational purposes. The Special Instructions allows for free text entry for any information that cannot be entered elsewhere. If a provider is not known or other information cannot be entered under the Orders tab, that information can be entered here. Care plan and goals are optional entries at this time, but will be required on future stages of meaningful use. CMS core measures for specific diagnoses are listed here. This is also a required field. If the patient was treated for any of the specified diagnoses during this hospitalization, they should be indicated, and the sections below will expand to show the appropriate questions. If none of those diagnoses were relevant during this hospitalization, specify none. When finished, click Save, and you can review the information entered. At this point, you can save this template as a draft or as a signed document if you're certain that all the information is correct. The final section in the Discharge desktop is the actual order to discharge. In order for the patient to leave the hospital, this order is required. This is the only way that the patient's nurse will know that a discharge has been ordered. Select the POM discharge order. Specify the date of discharge. And if any contingencies are required, they can be entered here. This will generate an order that goes to nursing so that they can begin their part of the discharge process. Click Save and enter your PIN number. When the nursing staff get the discharge order, they will enter the discharge routine, review all the information, verify all contingencies have been met, and they will finalize prescriptions and orders, locking all of that information, and subsequently print the packet for the patient. This concludes the demonstration of the discharge process for Meditech 5.66.